Good evening, friends. This is Dr. Chetna Jain again. I'm Director and Senior Consultant at the Cloud9 Hospital Sector 14 branch. Today, we are going to talk on which vaginal wash. Now, vaginal wash is a very standard subject. It's a matter of concern for every woman every day whenever you go to the pharmacy or a general store to buy vaginal wash, you get confused. You don't know which one to buy, what are the properties, what is the best one, which is the value for money, and whether you actually need to have a vaginal wash. Now, if you realize some 20 years back, there were no vaginal washes, and women used to wash with the same wash as the normal body wash. Now, over time, we got more cosmetics, we got hair conditioners, shampoos, moisturizers, and various kinds of creams for various parts of body. So, vaginal wash also came in. It's a multi-million dollar industry and it has spoiled us like anything. Now, who should be using? Who needs it? Whether all need it? That is a matter of question. So let's understand what vagina is. So vagina is a tubular structure which extends from the neck of the womb to the outside. It's a fibromuscular tube. And if you see, vagina is a self-draining, self-cleaning system. It doesn't need any kind of cleaning. That means whatever collects into the vagina, the secretions which are essentially produced by the cervix, they moisturize the skin, the skin, inner skin of the vagina. It lubricates it, and whatever extra is there, it comes out. Majority of the times, the vaginal discharge is transparent. It might convert into a thickish discharge towards the end of the menstrual cycle. In mid cycle, it's more slimy, just like when you put water in the lady finger, the kind of slime you get, similar slime is there present in mid cycle. This is to facilitate the entry of the sperm. Now, what happens is uh, the normal discharge is odorless. Mostly it is colorless. It doesn't stain the underwear. The underwear is streaked, but the stain doesn't form round. After washing, the underwear doesn't get discolored. So these are the signs of normal healthy vaginal discharge. You don't feel any itching, any soreness, redness, or any foul smelling coming from down. However, if you have any symptom that you have a color discharge, whitish, yellowish, pinkish, greenish, bluish, grayish, so these could be sign of infection. If there is itching, soreness, painful intercourse, swelling during intercourse, difficulty in passing urine, these all could be signs of infection. So if these are signs of infection, you rather see a gynecologist rather than washing your privates with a hygiene wash. Now, but hygiene wash may be a good idea to wash the vulva. Vulva is the external triangular area where the skin has a lot of hair. The skin is very delicate. It is very permeable. It is not exposed to sunlight and air. Hence, the chances of friction, infection, and other things are very high. It is essential, if possible, to aerate it sometimes in a day. When you have time, you can just close your door, open your legs, and allow the air to pass through your private parts. It keeps the skin healthy. While bathing, what you're supposed to do is wash with plain water, or you may use a little bit of baking soda so once in a while if you wish to. You can also use plain curds to wash your private parts. But a lot of women may not feel comfortable and they still would want to use some kind of hygiene wash. So if it is the case that you need to use a hygiene wash for your vulva, mind it, we are using it only for vulva. We do not intend to use this intimate wash for vagina. The reason is very simple. Vagina contains a lot of healthy bacteria, essentially lactobacteria. These bacteria produce bacteriocins, which are kind of antibiotic, which prevent the growth of unhealthy fungus and other bacteria or viruses into the vagina. So any kind of cleaning, douching, wiping will remove these bacteria from the vagina and the vaginal surface will become denuded. That means it will be devoid of any healthy bacteria. And when this happens, there is a high chance of any external agent invading. As you understand, the vagina is surrounded by organs which have many bacteria, especially the anal opening. So the tissue between the anus and the vagina, which is known as perineum, is loaded with a lot of bacteria and fungus. It is very essential to keep that area washed and cleaned every day, preferably twice a day, but not, if not possible, then at least once a day. During menstruation, it is important to wash that twice a day so that these organisms do not enter the vagina. Now, wiping, women who wipe or women who use moisturizers and other things to try to clean the vagina, they have greater chances of developing vaginal infection and greater chances of having other problems compared to women who do not try to clean their vagina. So we should never try to douche the vagina. What is douching? A lot of women sit into warm water, putting Dettol, betadine, and other stuff, Savlon, believe that this will clean the infection or the dirt or the inflammation into the vagina. This was also used traditionally to prevent pregnancy, but this is not the right method. So, douching, wiping, and cleansing of vagina should never be done. Think of yourself. You never put your finger in your mouth, in your ears, or in your nose to clean them. They are on auto cleaning mode. Similarly, vagina is also a self cleaning organ, and we should never put our fingers or anything inside to clean them. But yes, vulva needs to be cleaned, especially the place between the smaller vulva and the minor vulva. So there's a lot of collection of the white sebaceous material which needs to be removed regularly. Otherwise, the skin can get stuck to each other, or there could be bacterial infection, cuts, which are not good and can lead to painful periods or painful urination. So coming back to which kind of hygiene wash one should use. So what is important is it should be gynecologically tested. This is very important. Second, there should not be any perfume. A lot of women, they think that, the smelling good is a good idea down there, but God has not made that structure that way that you smell of jasmine or roses. For that, we have flowers. For the private parts, we should never be using anything perfumed. So any soap, any vaginal wash, or any wipe for that matter that you use has to be completely devoid of scent. It should be without anything. And some women can actually have allergy. So there's a possibility, or what one should do is you should do testing of these agents on the inner elbow to see that there is no reaction. Thereafter, you can apply a small amount on a small area of the vulva and see that it doesn't burn. So the product has to be tested. It should be chemical free. It should be scent free. It should be paraben free. It should not have many chemicals. And lastly, it should be used in the smallest amount and not very frequently. So daily, if you wash with just plain soap or plain water, that should suffice. You can also use some curds to wash. You should never use, there's no need to use moisturizers or oils or any other things to lubricate it because that will attract or catch further infections. So, what is recommended is wash yourself daily, wash from up to down, never come from down to up. That is extremely incorrect and wrong because it can introduce infections to your private parts. The vaginal pH is acidic and most of the soaps are alkaline. So it's very important to maintain the pH to an acidic level because all fungus, bacteria, etc., they grow beyond 5.5 and the vaginal pH is 4.5. So when you're buying the product, you should see that it's a pH balanced formula and a low pH product will work better than a normal body neutral pH because semen is alkaline in nature. So with intercourse, when the semen enters the vagina, the vaginal pH increases. And when it happens repeatedly, the pH is rising already. So in this light, if you use further alkalinizing agents, it can increase the pH further and cause further damage to the vaginal tissue. But any other abnormal discharge coming per vaginum you should seek attention to a gynecologist to see what is the problem there. So typically, a little bit of amount of wetness, which doesn't cause any irritation, redness, soreness, itching, smelling, or any other problem, should never be treated. At best, if you think that you are very wet, you may just fold the tissue paper and keep there, or you can use cotton panty liners, but try not to use synthetic panty liners or try. And the best idea is to wash yourself regularly, front to back, and keep yourself dry. Do not keep yourself wet. Aerate yourself if possible. A little bit of daylight will also help. We can understand that, the private parts can't be exposed to sunlight, but yes, you can still use some kind of daylight within the daytime by closing your door and see if you can somehow get some light and air there. That helps in healing very fast. Other than that, regular exercise, once you come back from gym, change your attire immediately, wash yourself first, wear cotton clothing, and then go to kitchen or other places. Because if you keep this sweaty and moist area for longer time, it can lead to fungal and bacterial infections and can lead to itchy, smelly, and dirty skin, and the skin can actually peel off. And this is most common you see in post-delivery where women tend to wear the same napkins over the day, and for many days the napkins are worn, and the family doesn't allow fans, or they're covered and they are put under blankets, and a lot of sweating is there. And because of that, a lot of women will come with napkin rashes. The skin is peeling completely down and becomes very irritated and nervous. Already they're not able to sleep, the baby is small, and all this is happening. Now, these women also do not need any vaginal wash, because if on the irritated skin, if you use vaginal wash, you're further removing the moisture and the healthy tissue, healthy bacteria around. So, if you have such a problem wherein you feel your personal life is getting disturbed, your skin is getting peeled off, or there are other issues, or if you're confused about it, whether you actually need, some women actually might need a wash for some time till the time there is infection or there's something which needs to be taken off. So for that, you can actually consult, but do not try to use these products on your own and damage a very healthy body, believing that you are using a health product and improving your health. You're rather putting yourself in danger. So once again, I just want to reiterate that whenever you want to buy a vaginal wash, use it only infrequently, use in small quantities, use as and when necessary by consulting your doctor, and use a hypoallergic, chemical-free, paraben-free thing which doesn't irritate, which is tested, and the most important thing is it should be non-perfumed. So these are certain tips, and if you follow them, you will stay healthy, your vagina will stay healthy, and to increase vaginal health, you can do Kegels exercise, you can walk, run, and also any kind of physical activity will make it strong. It is extremely important to do Kegels exercises post-delivery and otherwise to make the tissues strong so that in the old age you don't leak post-pregnancy and post-vaginal delivery. Thank you so much. It was wonderful talking to you. If you have any questions now, I'm open to take your questions. So there is a question here. Which product should I suggest for my wife for vaginal hygiene better than other products? So we just spoke about it. You have to study. So because no talking can actually, we cannot talk commercially about any brand name. So what you can do is you can just go into the various compositions and figure out that they do not have paraben, that they do not have chemicals, and that they are not scented. And if you are not able to identify, you can just go to the pharmacy, smell, and you see the pH balance. So with the low pH and with no smell, that's the best, and that also should be used as and when required and not on a regular basis. What is the reason of getting vaginal discharge every time? Now, altered vaginal practices are the most important cause of getting vaginal infections. It's so much so common that these days what happens is a lot of non-genital sex is happening. I do not want to elaborate it further, but I believe you understand, and that is essentially responsible. Other than that, use of unnecessary use of vaginal washes, vaginal douches, hygiene, even sometimes waxing and followed by when if you apply antiseptic creams, cleaning the vagina from inside, washing it with lots of soaps, and abnormal sexual practices can lead to vaginal discharge. Sugar diabetes is another very important cause of Vaginal infection, lack of physical activity, and a lot of sweating down can also lead to discharge and infection. So, vaginal discharge, whenever it is there, you have to differentiate whether it is a healthy discharge or unhealthy discharge. If it is healthy, do not mind it. It's part of body. But if it is unhealthy, it needs to be seen, investigated, and treated for appropriate duration. What is the right pH for intimate health? So, as you understand, that the vaginal pH is 4.5, so any wash below that should work. What is the reason behind the cyst is produced inside the vagina? Oh, yes. So this cyst is a very common problem. This is known as Bartholin cyst. Now, Bartholin cysts are present at the entrance of the vaginal wall on both the sides, on the right and the left, because we have two Bartholin glands. And sorry, and these glands can get blocked because of infection. And once they get blocked, once it starts happening, it happens repeatedly. And to get rid of it, eventually the Bartholin gland itself with the cyst has to be removed. So it is important to ensure that you wash the vulva well, that it doesn't get blocked. You do not touch your private parts without washing your hands. Always wash from front to back. Avoid keeping nails because nails can never allow you to maintain good hygiene, and thereafter it can introduce infection. So possibly all these if you do, then there's a possibility of preventing bacillences forever. But bacillences, whenever they happen, they are treated best the first time. When they happen repeatedly, they convert into abscess and the treatment becomes extremely difficult. Thank you.